Dr. Paul Frank here at PFRANKMD, and today's IGTV topic is hair loss. And this is a conversation that could go on for hours, but I am going to give a short, sweet review of what causes hair loss, how we could treat hair loss. This is a battle that's been going on quite a long time. We've been 5 to 10 years around the corner for curing hair loss for about 30 years now. So it's important to know that although we aren't quite there yet, we have a lot of things that we offer. Hair transplantation was invented a generation ago. Topical minoxidil, which is now over the counter, and Rogaine was invented a long time ago. But there are some new tricks, and the things that we do have over the last generation have gotten better in both topical and surgical therapy. So first and foremost, what causes hair loss? We know that nothing is ever 100% nature and nurture. It does have a very strong component, whether you're a man or a woman. It is very hormonally driven. It actually has more to do with the sensitivity to certain types of hormones like testosterone and estrogen in the body. There are also a lot of exogenous causes. People who are pregnant have hormonal problems, thyroid issues, various fluctuations in hormones naturally or due to disease can cause hair loss conditions that can be both temporary or permanent. And again, this is a conversation that can go on a long time. But most people that come in are having genetic forms of hair loss. Women go through it as much as men do. It tends to happen a little later on in life, around the perimenopausal time. But the treatment options are relatively the same for men and women. First and foremost, rule out any medical condition. Make sure there's no thyroid issues or hormonal imbalances that are atypical for the person, either the man or the woman, and then really address the problem. Now, we know surgery is always the last resort, but for people that really have significant hair loss, it really still is a great option. I don't perform hair transplant surgery anymore, but I do value its place, and follicular unit extraction and transplantation is the standard of care. You don't have to look like you had surgery, and for the right candidate, it really is the gold standard. But you don't want to jump in the deep end before you try the simpler things. We have seen a lot of advancements and even topical therapy. It's not just Rogaine anymore. Now we have privately compounded formulas even in doctors' offices, such as myself, our private label PFRANKMD line. We combine several substances, minoxidil being the mainstay at about 7%. Now for men, we're actually using topical finasteride, replacing a lot of the needs for oral therapy to minimize any side effect profiles that can come from the pill. So we have our male solution, which combines 7% minoxidil and 0.1% finasteride. For women, we use topical combinations, which may include some hormonal therapies like progesterone and minoxidil. So, I always say do the simple thing first when you're doing something cosmetic, and I think topical is an excellent way to start. One of the hot treatments that's available right now is called PRP. This is something that people have been using in rehabilitation medicine for years, where we draw one's own blood. We isolate the growth factors that are found in the platelets, and we're able to use that for regenerative and rejuvenative purposes. I'm not a huge fan of using it in the skin for anti-aging, but I've seen great results, and studies do show its efficacy in hair loss, both genetic hair loss and also exogenous causes of hair loss, like telogen effluvium, which women often get after pregnancy. It does speed up the natural regrowth of the hair, and it thickens what you already have. It's important that you're evaluated by a medical healthcare professional to really find out what the cause is and what is going to be the best treatment, because there isn't going to be a best treatment. And you also have to see the type and severity of the hair loss. If someone has a totally empty, bald space, then topical therapy may not work. If that may be someone who's best for surgery. PRP is for someone who has more like generalized thinning than empty spots as well. So PRP is a very common treatment that we're doing now. You do it 3 times, once a month for 3 months, and depending on the severity, often we're recommending it 1 or 2 times a year. Also a great treatment to combine with other things like hair transplantation and topical therapy. Also, a lot of people still are on the oral therapy of finasteride or Propecia that we use primarily for men. A lot of patients ask about supplementations. There are a lot of products on the market. for hair growth supplements. And I will tell you, the supplement market overall could be very, very deceiving. There are some supplements that I won't name that some may strengthen some of the hair that you have. I know a lot of people take biotin, and there are some brand names, but there really is no supplement out there that's going to grow hair from nothing. So the only point I want to get across in terms of the supplement market is buyer beware. They can be expensive. They do involve taking pills. The supplement market is highly unregulated. We don't know exactly what's in all of them. They come off as very naturopathic types of therapies, and just be cautious. They work for some people, but they are not magic wands, and really they should be only a supplement, a complement to other things that have really proven its efficacy. Topical therapy is helpful. Hair transplant surgery is helpful. PRP therapy is proven. And it's going to bring me to the last thing that I'm real excited about, which we've been doing on our IGTV, and that is a new camouflage technique that's come a long way, and that is scalp micropigmentation. And this is really a form of tattooing. It's a form of micropigment tattooing. And this kind of micropigmentation we're seeing now in eyebrow treatments, lip blushing in various different forms. But in its use for camouflage, for hair loss, it really is a great supplement to the other things that are out there, because let's face it, everything is about good lighting and makeup. So if you could have a permanent form of makeup to help camouflage hair thinning, wouldn't that be great? And this is headed up at the PFRANKMD Skin Salon by our master cosmetic tattoo artist, Christopher Drummond. And what's great about the treatment is that it's great for all skin types. We use it on men and on women. It's a simple procedure that's performed safely and quickly. It doesn't require touch-ups usually for at least a year, and it doesn't take that long to do. So it's really a way of pigmenting the scalp in a way to decrease that see-through aspect of it. So that's something you can come in and find out more about. But I find, as with most cosmetic treatments, it's really about the combination of small things that's going to make the biggest difference for each individual patient. And which combination and which treatments you're only going to find out by seeking the care of a professional who not only knows the cause of the hair loss and knows all the options, but offers all the options. Because if you have a hammer only, everything looks like a nail. So it's really how you play the symphony of all these things involved. And hopefully here at places like PFRANKMD, we can share all those details with you. So again, hair loss is a very difficult thing. It's not going away. We're not finding a cure anytime soon, but we are getting better and better tools to battle it. And if you have any questions, you can DM us, come visit us for a consultation to see one of our various professionals. And we have new exciting things every day here at PFRANKMD. So hopefully you guys enjoyed this, and we will see you on consultation.